Hello everyone. In this video we will talk about the much talked about the coronavirus outbreak in the Chinese city of the Wuhan, and we name it the 2019 NCOV. 2019 was named because it happened during the last days of the 2019, and we call it N. N stands for novel. Novel is a French word for new. So N mean new. Why we call it new? Because the virus which had belonged to the coronavirus family or coronaviridae is a mutated form, is a new pathogen. It had never existed before. So it happened in a city, Chinese city of the Wuhan. Wuhan is the seventh largest city in the China. Now, if this is, for example, the sort of Chinese map, Wuhan is located in the Hubei, Hubei province, and it's the seventh largest city in the China with a population of the 11 million. So that you can have some idea that how many people are at the risk of this outbreak. Now, there is a story that certain hospitals in the Wuhan city, they started receiving a group of the patients around 30th and 31st of December of the 2019. Now, these group of the people who were coming to different emergency departments in the city of the Wuhan, which is located in the on the mainland of the China towards south side of it. So these patients, they were suffering from specific symptoms. Majority of these patients, like 98% out of every 100, 98 of them complained of the fever. They were complaining of the cough, which was mainly dry, and later on they also developed the respiratory distress. And when the Chinese doctors, they had their CT scan chest, computed tomography chest, they found that majority of these patients also had pneumonia. So much so that one of the family, when they underwent all these testing, and these tests were performed on them, one of their kids who was almost 10 years old and didn't have these much of the symptoms, when the CT scan was done, out of curiosity, there were certain features of the pneumonia on the CT chest. So one thing was particular, there were two very specific features about these patients who came to different emergencies in the same locality of the Wuhan city. They came with fever, dry cough, respiratory distress, and when CT chest was performed, they had features of the pneumonia. Now, there was one very important point about majority or all of these patients. They were coming from a very specific part of the Wuhan city where there was a market. The name of the market was Huanan Seafood Wholesale Market. So one important feature about these patients was that they were not responding to any conventional antibiotic. They were not responding to any conventional treatment, and majority of them had visited recently Huanan Seafood Wholesale Market, where the live animals are also sold. So all this was happening around 30 and 31st of December and 2019. So even there was an example that whole of the family, like 4 or 5 members who had visited the hospital, they had recently gone to this same market. So the doctor started thinking, is there a point source? Point source is the source which you can pinpoint. So the doctors, when they took history in detail, they ultimately came to the conclusion that something is wrong in this market. There is a problem in this market. These people have been exposed. So their blood was taken and genetic studies or molecular studies were performed. Now, the studies which were performed, these were the real-time PCR or polymerase chain reaction. Real-time PCR and next generation sequencing of the DNA was also performed. And when the doctors and the scientists, they performed these tests, they found out that when they decoded the DNA of the pathogen, they found out that 90% of this DNA has got the similarity with the coronaviruses which were already found in the bats. So it seemed that this is a type of the coronavirus. Why we call it coronavirus? Because when we look the virus under the microscope, they have a crown-like appearance on their head. So that is why we call it the coronaviruses. Now they had seen that 90% of their DNA has matched with the coronaviruses which were already existed in the bats. And this is not the first time it happened. Coronaviruses have been existing in our society for a longer period of time. In majority of the cases, when they infect the humans, they cause only the upper respiratory tract infection. They so oftenly infect the birds and the bats and the snakes. But there has been certain instances when there was a mutation in the coronaviruses and then it started causing the severe disease in the humans. And not only they started involving the upper respiratory tract, but they favorably started involving the lower respiratory tract. What are the examples? The examples of the coronaviruses which had mutated and then they had caused infection in the humans, like in 2002 and 3, in late 2002 and early of the 2003, there was a severe acute respiratory syndrome in China and the vector was bats. It had infected 8,098 people. So infections were a little above the 8,000, and it has caused 747 deaths. So it was an outbreak of the coronaviruses which had mutated from its normal form. Another example of the mutations in the coronavirus which resulted in the demise of the humans as a result of involvement of the lower respiratory tract was Middle Eastern respiratory syndrome, which we also call the camel flu, because the people contracted when they came in close contact with the camels, and it happened in late 2012 and early 2013. And as it is clear from the name Middle Eastern, it happened around the Arabian Peninsula and Kingdom of the Saudi Arabia and Egypt, these kind of countries. Later on, it did involve a lot of other countries. It had caused 400 deaths, and this virus infected around 1,000 patients. So there were 1,000 patients and there were 400 deaths at the hands of the Middle Eastern respiratory syndrome. Now let's come back to the story of the Wuhan hospitals. Now what happened that once the doctors, they have identified the virus as the coronavirus, they named it coronavirus 2019 nCoV. Coronavirus CoV, N for the novel or the new, because it was a mutated form, it never existed before, so it's a historic time in the medical community of the world, and it happened at the very end of the 2019. On the 30th and 31st of December, people started reporting their symptoms to the hospitals, which were the fever, dry cough, respiratory distress, and pneumonia on the CT scan. Now, on the 9th of January 2020, first person or patient died at the hands of this virus in China. And up till now, today it's 30th or perhaps it's 30th of the January, and 2000 it's 31st of the January 2020, and up till this time around the infection has exceeded 8,000. It is 8,000 plus people are infected at the hands of coronavirus, and there are 171 deaths. You can track it on the YouTube by writing down live coronavirus update. Then there will be a channel. You can track the death rate and the infection rate minute by minute, and it is being run by the WHO. So on the 9th of the January, the first person died in China, and up till now 171 have died, and all are the Chinese. But the first local infection which was noticed in the adjacent country, near on the southern border of the China, there is Vietnam. In Vietnam, a father who had visited Wuhan, when he went back to the Vietnam, he transmitted the infection to his son. So that was the first local infection transmission outside of the China. And then thousands in kilometers away from China, in a part of the Germany which we call Bavaria, it's a landlocked state. A Chinese businessman visited a Bavarian man, and during that meeting, which was a business meeting, he was coughing and sneezing, and the Bavarian man had no family members infected already. But the Bavarian man caught the infection from the Chinese person who came to see him, and that person has visited the Wuhan before he had traveled to the Germany. So on 22nd of the January 2020, first case outside of the China and Asia. In Europe, there was a case in the Germany in the state of the Bavaria, and it was transmitted there by a Chinese businessman who visited the Bavarian person on a business trip. And up till so far, 4 Germans have been found infected with the coronavirus 2019 infection. So this shows the infectivity of the coronavirus. And up till now, there had been 5 cases in United States of America, 3-4 cases in Canada. There are people who are suffering from the virus infection, one from Nepal, one from India, and one from Sri Lanka. Then there are people from the Philippines, Japan, and South Korea. There has been one person infected in South Korea, and Hong Kong has its own share of the infection. Australia has got some people infected because they were there for the New Year celebrations in China. So this is the scale of the this infection, and last night WHO has declared it as a global emergency. Now the people are quite scared because in history there has been pandemics, like in 1918 there was influenza pandemic in the Spanish area, and it cost 50 million lives. So these are very horrendous diseases. If they are not brought under control, they can play havoc to the humanity. So what happens actually with the coronaviruses? Now let's go again back to the Wuhan hospitals and the seafood market, which is a Hunan seafood wholesale market. So coronavirus is basically, if I draw the diagram of the virus, it's a RNA virus. This is the ribonucleic acid and it's single stranded. It has got a helical capsid which saves it from destruction when virus is outside of our bodies, and it's a enveloped pathogen as compared to the naked viruses. This is the enveloped coronavirus, which is RNA or single stranded RNA virus, and it contains the helical capsid. Now these viruses are called semi-living. They are put on the edge of the life. They are neither living nor dead. Why they are not living? Because they are not cellular, they are acellular. Then why we don't call them dead? Because they have the capacity to replicate, and they replicate pretty fastly. But they required a host. They are obligate host dependent pathogens. Now what happened there? That the protein in the virus had already mutated. That mutated virus was present in the bats. Those bats, they were sold in this market. So, some of the people came in close contact with the bats, plus somebody had enjoyed or ate the bats and their soups, which is a normal routine there, and this is how the virus entered into the human being. Now once this virus has entered into the human being, what it will do with the human cells? It cannot replicate outside of the body, but once it is inside the human body, what it will do with the human cell? It will take over, it will take the control of the DNA and RNA of the human body, and it will ask the nucleus or DNA and RNA of the human body to make RNA for the virus, not for our bodies. Normally our cell's nucleus, DNA and RNA make protein for our purposes. But once this virus has entered into the human body, because it has got certain spikes here, and once it is there, what it will do, through those spikes, it enters its RNA into the human cell. It takes control of the human DNA and RNA. It will ask it to make a lot of the RNA for the viruses. This is known as replication, and this replication happens very fastly. Now once this replication has happened, a lot of viruses will be formed. A lot of the coronaviruses will be formed not by the virus itself, but by the human DNA and RNA, which has been taken control by the virus itself. So replication happens in the human body, and a lot of coronaviruses, they are formed. And once they are formed in a higher quantity, our immune system, our lymphocytes, they try to identify them. Then they just see that these are the foreign epitopes or foreign antigens. They start forming the antibodies against them, and it causes in our body certain clinical features like the fever, muscle pains, and we have body aches, we have difficulty in breathing. Why? Because when the concentration of the virus in the body goes very high, it enters into the secretions, and majority of these viruses, they enter into the secretions of the lungs. Now in the alveoli, as a result of our defense mechanism, a lot of secretions are made by the body, because that will help us against the virus. Body thinks that it will help the body to not let the virus attach with the epithelium. So we try to cough out those secretions, but the problem is now that those secretions contain a lot of these viruses, which were made by our cells, because it had come under the control of the virus, which is now in a mutated form, and we got it from the bats. Now when we cough, like if I have got the coronavirus, and my lung secretion, they are full of the viruses, and when I try to either sneeze or cough, then it will be in the droplets, and those droplets will stay for some time in the environment. And when some other person inhales those droplets, which contain a lot of these viruses, then the same process will start again. That virus will enter into the human body, enter into the human cells. It will take control of the human DNA. It will ask it to make RNA for not for the human body, but for the virus itself. So a lot of replication process will be kicked off. So we come to the outside environment. Now there is another dreadful thing about it. The incubation period of the virus is the time when patient has got the infection, the virus has entered into the body, but there is still no sign and symptoms. Now the incubation period of the coronavirus is somewhere between 2 to 14 days. But there is a problem now. There is a huge problem that if I'm not having the symptoms like the fever, which is a defense mechanism from the body, because virus cannot perform when body is running high fever. So this is a defense mechanism which is carried out by the lymphocytes with the help of cytokines, which have their effect on the hypothalamus as a thermostat is set high. So what will happen, even if I'm not showing my sign and symptom, I may be carrying the virus because I'm in the infectious period, in the incubation period, and I may be shedding the virus for the other people. This is a huge problem, because up till now in China, people have been screened with the help of the thermometer. They were holding the thermometer, and if someone is running fever, he was excluded from the lines and he was admitted in the hospital for further workup. But what if the patient is in the incubation period, has got no sign and symptoms, and still is infectious, can spread the infection? So this is the one of the most dreadful aspect of the coronavirus 2019, which makes it different from the MERS and the SARS, because in those patients they were only infectious when they were symptomatic. So incubation period is 2 days to 14 days, or it can be up till like 1 to 2 weeks. So all those patients who are living the endemic area, they should be isolated or quarantined for at least 2 weeks. So the persons who's infected, when he or she is coughing and sneezing, he or she will be throwing the droplets in the society or environment, and those droplets will contain the coronavirus, and those coronaviruses, they can go in, they can be inhaled by anyone, and it can cause the infection. So here comes then after the diagnosis, if you suspect someone, then what is the management? There is no specific treatment. When we are to talk about the treatment of the coronavirus infection, what is the treatment? No specific treatment is available up till now, though certain companies and pharmaceutical companies and association, they are trying to build a vaccine or some modality to treat, especially they think that AIDS medication can help, but it's still a hypothesis. So no definitive treatment is available. Only sportive treatment. Only sportive treatment. So try to understand one very important thing. The person was sneezing and coughing and throwing the droplets in the society. So put masks on the patient and put masks on all those people who are moving around. That is one big thing. It does not enter through the skin. It enters through the mucous membrane of the eyes, nose and throat. So put a mask. This is very important. Whosoever goes outside of an area where there are certain people who are infected with the coronavirus, everyone should wear a mask, and it should be N90, N95 for the best result. N95 means that 95% of the microorganisms are droplets are sort of prevented from entering into the body. But mask should be worn, and there should be glasses which are wrapping around the eyes, because once a virus enters into the eyes and the mucous membrane, it can go all the way down into the every part of the body. So one thing, no definitive treatment is available. You need to isolate the patient. You need to quarantine the patient. If the patient is dehydrated, you need to give IV fluids. IV fluids if patient is dehydrated. And if patient is short of breath, which happens in these patients, put patient on the oxygen either through nasal cannula or face mask or non-rebreather mask. Non-rebreather mask. So these are the ways to give oxygen to those patients who are short of breath. But the deadliest things are the most dangerous things which the patient ultimately go on to develop will be ARDS, acute respiratory distress syndrome. Acute respiratory distress syndrome, and these patients will definitely require mechanical ventilation. Mechanical ventilation. Now the disease period is around 1 to 2 weeks, and during 1 to 2 weeks these patients may need mechanical ventilation. They will need oxygen, they will need isolation, they may need IV fluids if they are dehydrated. So only supportive treatment is available. No vaccines, no medications. No vaccines, no medications up till now. And if you suspect that someone has visited the Wuhan city, and he or she is either your friend or family members, and you suspect that the patient may be developing something like this, like the fever and the cough and shortness of breath, and do contact the doctor. But please, before you contact the doctor or before you send the patient towards the doctor, do call the doctor and tell that you are suspecting your loved one suffering from the coronavirus infection. Because if you send the patient right away to the doctor and the staff, they are exposed. So please try to tell the doctors and the staff nurses and notify the hospital before the patient is sent to the hospital, so that precautionary measures could be arranged over there. Isolate the patient. Do not visit, if you want to prevent catching the infection, do not visit the endemic areas. Do not visit those areas where you think the people are suffering or they have started suffering from the infection. Use the wear the mask, wear the eye wrapping glasses, and try to contain yourself towards your homes. Do not go to the busy places like the markets. Do not do the frequent air travel, especially towards those areas which are risky, and these are increasing in number. And avoid joining the gatherings, because each one of these will put you at a higher risk for the development of the infection. If you are not sure about these things, please watch the videos of those people who are to be evacuated from the Wuhan city, and they are going through a lot of pain and suffering. So no definitive treatment, need to isolate, need to use these preventive. If you are to cough or sneeze and you haven't got a mask, then you can use your sleeves instead of your hands. Because how you will catch the infection? For example, if I'm suffering from the coronavirus infection and I'm sneezing and my hands have got the droplets, and I'm putting those hands on a table or any other object, then I just move away and someone comes there and he or she puts the hands on those tables and later on touches the mouth or the eyes or oral cavity with those fingers, there will be entry of the virus into the body. So the one of the most important thing which we all should remember is washing the hands frequently. We need to wash hands frequently, and we should wash them thoroughly, rubbing it all over all the fingers, and especially the area between the fingers. We should wash it this way, and we should do it for at least 30 seconds. We should use the soap and the water to thoroughly wash our hands and to rub the fingers and the areas in between the fingers, so that we get rid of the virus. Because if we are touching the oral cavity and the eyes with the help of the hands, which we had come in contact with the secretions for some patient, then we are directly transmitting the infection to us. If there is no soap and water available, we can use the alcohol-based sanitizer to wash our hands. to do desanitization or to desanitize our hands, though this is an inferior choice as compared to the soap and water. So this is an ongoing disease. This is an ongoing threat to the humanity, and still it's people are being updated, and this was the knowledge up till now, that it's a variety of the coronavirus. It has got its mutation. Everything started around 30 and 31st of December 2020. It started in a city of the China which we know as Wuhan, which is present in the Hubei province. It is the seventh largest city of China with 11 million people, and now up till now 171 people have died. All of them were from China, but it's spreading. Infection is spreading to the rest of the world because of the very fast air travel, and we need to be very cautious about it, and we need to use preventive measures to avoid coming in contact with the virus. And if there is a suspicion of infection, then we need to isolate ourselves, and we need to inform the health authorities about our conditions. So I hope it's a little bit of the information for the coronavirus 2019 nCoV. And please, at the end of this video, like the video, share the video, subscribe the channel, and press the bell icon, and